This conference will now be recorded.
Hey, David.
Hey,
It's Andy. Good afternoon.
hello, thank you.
How are you doing?
Oh, hanging in there,
Good.
hanging in there. How about you?
I am doing the same, hanging in there.
Are, are you working remotely or
I am working remotely and I've never worked as hard. It seems like every hour I have another meeting.
it's incredible? And you know, that statement, you know, never work so hard is absolutely a fact. It is so incredible. Never work so hard. Of course, we've been here every day. Well, you know, every every day that we're open.
Yeah, somehow people are finding, I guess, instead of coming to my desk or calling me, they're finding every little white space on my calendar. And it's just wall to wall meetings.
It is, well, it's wall-to-wall phone calls, wall-to-wall, you know, just discussion pieces. You know, everything, we're involved in everything, you know, local health departments, we're being asked for advice on just everything. And, you know, lots of things that we've never regulated before and still don't regulate, but, you know, it's all under public health.
Yeah.
Public health right now.
Well, I'm sure there are a lot of people like me who really appreciate having someone like you at this time. So thank you.
I don't know, Andy, did you get the email with the attachments?
I'm checking right now.
Yeah, because I sent some attachments that I think might be useful.
Okay, now what do we do? I think, are you in it? Well, I guess. I don't get anything recorded here.
Hello?
Hello? Hello?
Hi, who's this?
Hi. Hi. Is this Dave?
It is.
Dave, it's Jennifer Geddes.
Hello, Jennifer.
How are you? And Christine is here. So we're on the phone. We couldn't get in the
Oh, great,
computer.
okay. Am I loud enough for you? Can you hear me?
A little bit. Can you do it a little bit louder? Just a little bit.
Yeah, I've been told that this isn't as loud. I didn't have a microphone before, so George came in and gave me a mic and a camera. And I understand that maybe the microphone isn't as loud. I'll just try to speak up.
Okay.
Hey, Mac,
Yeah, hi, David.
you're pretty loud.
Oh, yeah. Reaching for my volume button.
So I guess we just need Kevin and we're good to go.
So yes, I did get the attachments.
Okay. Mac, did you get the attachments? I sent,
Yeah, yes.
okay. Yeah, I think they're kind of
Is,
helpful.
is there going to be a test?
Not yet. No, no. It's been a test for me.
Oh,
And it's a test for me because I don't
yeah.
usually do this. I don't know what I'm doing.
We're all just kind of muddling through as best we can, right?
Right.
David, your hair's gotten a little longer.
I heard that the salons were closed. I can't find anyone to cut my hair. I went for a while without shaving too, only it got too irritating. You know, the
My
cold-
daughter's trying to put a ponytail on me now.
David, I've started the recording on your meeting. I'm going to kind of zone out here, so just shoot me an email when you're done.
Okay, we'll do, Kate. Thank you.
Yeah, thanks, Kate.
Can you hear it, Christine?
Yeah, I can hear it. There's the second one I got to. Let me see. Oh, there it goes.
Hello?
Yes?
You're still there.
Are you recording? Are you doing your meeting? Because we're not hearing anything.
No, we're not doing a meeting yet. We were sort of waiting for Kevin, I guess.
Oh, okay. All right. I
We-
just didn't know if I was missing the whole thing or something.
No. We wouldn't let that happen. I don't know, Mac, if you want to take over the reins?
Everybody's hiding. David,
I know. You want to take over the reins until Kevin joins us, assuming that he will? Did you hear me?
I'm sorry, what's the question?
I asked if you would be able to take over the reins, open the meeting.
Oh, sure.
Might as well get,
Let's,
yeah.
let's go ahead and call the meeting to order. David, probably the first order of business is to approve the minutes of the last meeting.
Yes,
I believe you sent them out.
yes.
Any comments or anything?
I
No.
motion to approve.
So probably ought to, no comments or anything. Let's go ahead and all in favor of approving them.
I'll make a motion to approve them. Yeah.
Okay. Okay. Unless I hear differently, I believe it's unanimous.
Like it that way.
So David, I guess the floor is yours.
Well, everything has changed. Life has changed for everybody, hasn't it? Certainly has changed for the health department in the past, 4 months. Ever since I got the first phone call of a returning traveler from China on Sunday, February 9th. The last day off I've had without talking COVID, work-related, was February 8th, Saturday. But since that time, we've gone through the big push. We had a pretty significant outbreak. And if you have a chance to look at the email attachment that I sent, I think that in particular, the chart, the weekly summary chart from last week, really shows the trajectory of illness in town. With positives by week, we broke down positives on a weekly basis, beginning in the first week of March. And the good news is that for the past, since May 29th, we haven't had a positive case. We also we also illustrate the positives by age. And of course, in Darien, we have a very significant under 20 population. And as you can see, the number of cases for that particular population is relatively low. Everybody's worried about their kids. What they should be worried about are themselves and the grandparents. So if you continue on to the next chart, we have the grim news, the hospitalizations and deaths. We had a grand total of 16 hospitalizations over this whole period of time. And that's verified through state reports. You know, the total numbers of cases, of course, is much lower than the actual number because a lot of people got sick and either didn't get tested, couldn't get tested, or the doctors just diagnosed COVID without testing. So we know that there were a lot more cases of COVID than what we have reported. Those are laboratory confirmed cases. But we do know that the hospitalization number and the deaths are firm. And with respect to, at the bottom of that chart, there's a, it says 16 hospitalizations. That's not current, that's cumulative. And currently, as of last Friday, there were 4 people still being hospitalized. We, part of the big challenge here during this course of this outbreak has been a daily review of reports from the state health department on positive cases. We instituted a drive-through testing facility in town. We were one of the first communities in the state to do that. We gotten quite a bit of use. And again, you know, even though we have it here and we're doing 50 to 60 tests a week, you can see our numbers are really low for positive cases now. We're thinking that with the end of July, I mean, with the end of June and summer school and not summer school, but summer camp and activities at the school, we think that we're going to close down the drive-through operation at the school and move it somewhere where it's not going to be in such public view and in such a public location. So we're looking at another location for the drive-through. There's still a demand, public is interested in it, so we think we're going to keep it. And we'll probably add antibody testing as a choice for residents when they go to get tested. So I guess the good news is really, you know, I want to focus on the good news. And the good news is things are getting better and have gotten a lot better than they were in March here in town. We're reopening. Everything is reopening. While that's a great thing, it's created a tremendous strain on our limited department. The town hall had gone to limited hours and split schedules. We really never did because we're essential. It's a public health crisis. So we've been here and working most of the time during the peak of this outbreak. Our work was confined here in the office. We really didn't do inspections. We weren't doing food service inspections directly of the facilities that were remaining open. But what we did do was we were charting and through daily interviews with facilities that were open, employee health, and also going over food temperatures and having them maintain daily logs of their activities and food service protection. So we maintained a regular dialogue with our facility, even when we weren't in the facilities on a regular basis. Ever since I guess it was May 20th when outdoor dining was being allowed with social distancing and masks. We have been visiting the facilities. We have been ensuring social distancing. Seating is being maintained. We've provided masks to food service facilities, cloth masks that were donated from local artisans who made them. We've been giving the reusable cloth masks to food service employees and providing the facilities with masks to customers should some come in without masks, just so that they have them when they enter the facility. as the opening continues, the state issues guidance, and Reopen Connecticut guidance. And there's guidance for, and it changes all the time. I mean, it changes from day to day, week to week, and they're making modifications. But the type of guidance that we've received includes that for restaurants, personal services, which includes the nail salons, day spas, tanning, tattoo, waxing, massage therapy, nail technicians, eyelash technicians, hair salons and barbershops, sports, gyms, fitness centers, pools, public pools, indoor recreation, outdoor events, and libraries. So we've been in touch with facilities all across the spectrum and things they need to do, should be doing. We've worked with our schools, with our park and rec department with respect to beaches and bathhouses at the beaches and our seasonal snack bars. The spectrum is really unlimited as to what it is that we've been engaged with. But getting back more to the meeting that I submitted, we also have this extra challenge of our administrative assistant here is out. And so all of the work we're doing with respect to permits for pools and seasonal facilities, distributing PPE, which we're doing to all our healthcare providers. We have weekly pickups from the National Guard of PPE for our healthcare facilities, and distributing them to our providers in town. Shellfish permits, tick reports. We have to manage all that in the office. We have no admin, and in the office we're doing all of that, processing checks, making deposits. That's been an added challenge to the challenges that already exist. As I said, inspection processes for food service had been limited until recently. We were only conducting surveys of the open facilities by phone and email to track employee health primarily. With the recent allowance for outdoor dining, we've done inspections. And we're going to continue doing that. We plan on reinstituting our ratings program beginning next week when we start doing full inspections of our restaurants. We added a part-time nurse to aid in our follow-ups and interviews with the positive COVID cases in town. That was a tremendous help, and I really appreciate the assistance that we got from the nurse, who's an employee actually of the school nurse, part-time school nurse. She was fabulous in helping us do our follow-ups. We learned a lot about the nature of the disease as it ran through residents. We reached and got interviewed and managed to interview about 70% of the people who were reported, which is pretty high considering a lot of people are not really willing to talk to the government, shall I say, or, people cold calling them to ask about their health. So the fact that we got 70% participation in answers was really, I think, pretty amazing and a tribute to the community. We had a lot of issues with the state data, following up with accuracies. The phone numbers were missing or wrong, and addresses in a lot of cases were wrong. But as I said, 70% is pretty good. Now, as part of going forward in anticipation of potential resurgence of this, we're looking towards planning in the fall for expanded clinics, whether it be for vaccine for COVID or just initially anyway, more availability for regular flu vaccine. it's not anticipated that there'll be any COVID vaccine available to the public at large in 2020 at this point. There's some discussion about potential toward the end of the year of having limited amounts for, the first responders, but not to the public in general. So we're going to have to look towards planning, probably doing some winter clinics, and that will pose its own challenge and staffing issues. Contact tracing, should there be another resurgence? Right now, we can't do contact tracing because all the cases are really beyond worthwhile following. 10 days is really the limit. So we haven't done anything, but we are signed up with the state system for doing contact tracing through their website. And I anticipate that being a little more problematic than just doing the general interviews, simply because there's a lot of privacy issues involved where people are going to be asked to give information about their contacts, their friends, their family, and and we'll be calling people, and I'm not so sure how successful that will be. I'm going to take a break right there and ask if there's any questions. That was a lot of information, I know. So,
David, thank you. My dogs, of course, are going crazy now. Thank you. I dialed in a minute or two late. My computer didn't like go to meeting for some reason, but thank you. Does it make sense to, knowing that probably not for Q4 at least 2020, but to dust off the mass vaccination plan that you have, we certainly all worked on, and think about if there's going to be some community distribution, how we might play a role in that. Again, probably not within the next 4 or 5 months, unless some miracle.
You would think we should, and it's a good question. And with all the planning we've done for PPE distribution and med distribution, you would have thought the state would have utilized the plans that we had for that with the PPE, but they didn't. And so what they did was they're bringing everything into Sherwood Island, and everybody has to go to Sherwood Island once a week to pick up the PPE that they're bringing. It had nothing to do with any of the planning that we've spent years doing as far as the distribution centers. And with the statements and the state has been very slow in saying dust off those mass vaccination plans, because there's the thought that the rollout for the vaccine is going to be very slow, probably similar to what happened with H1N1. And if you remember that, we got stuff in dribs and drabs, and we had to basically give vaccine almost by appointment. So they have no idea, Kevin, how this is going to work.
Now, David, why do you have any sense as to why? I mean, we put so much effort into this, the distribution plan, we partnered with Stanford, we drilled it. Why they just completely disregarded any of that distribution channel that we've been working on for years?
I think it's because DPH, who is really driving that part of the program, has taken a back seat to this COVID response. It's just been a lack of leadership on the part of the department. And so, I don't anticipate it being any different going down the line. I mean, I'm sure you heard our commissioner was fired or resigned back in March. Mm-hmm. And that was over conflicts of plan and approach with the governor. So, I mean, we in local health were flabbergasted with the fact that they weren't going to be following the plans that we'd worked on. And it was like,
Interesting.
okay, Druid Island, here we go.
Hmm.
And
Okay.
that's what we're doing.
All right. Well, as always, I'm happy to help you
Thanks.
and or Nick on those dust off those plans and see if there's anything we need to do looking into the future in terms of mass distribution, vaccination, those type of things.
Yeah, and if everybody doesn't know, Nick Jossam is our preparedness consultant. He's been invaluable with getting the PPE. He's been picking them up every Monday, bringing them here, and also has been overseeing the drive-through testing site. He's been great. He's been terrific. As have the nurses, as the entire staff has been just so willing to, go the extra mile to do what we need to do, here, getting things done. And I think we've done well. It's been a challenge, and we're hanging in. Any other questions or comments so far?
No, not from Christine or
No,
Jennifer.
Okay, so, as far as our activities, under number 4, just backing up a little bit. I think that things have slowed down enough that we're going to revisit the need to have the extra nurse at this time. I hate to lose her to another job if we end up having a second wave, because she's so good at doing what she's done. But at this point, there's nothing to follow up, so there's no cases to review. So I want to also give her special acknowledgement for the help that she's, given us. I mentioned the PPE to local healthcare providers. There's first of all, there wasn't enough, then there's too much. We must have 15,000 surgical masks here. There weren't any to go around. We had people making masks, bringing them to us so that we could give them to people working in restaurants in March, because there weren't any masks. That went over very well, by the way, and we must have given out, we must have had about 300 or 400 masks donated to us from various organizations in town that made them. Really nice masks. And since then, now we're giving the PPE of varying levels of quality, all of which, interestingly enough, is from China. I mean, it is just amazing to me. We're so dependent, again, on China for our supplies. Inspections, we are getting back out in the field. We've been doing septic work all along as necessary. We can maintain social distancing doing that out in the field. But things have really picked up a lot in that area. A lot of requests for soil testing, a lot of real estate transactions. The real estate market's coming alive, and anytime there's a septic, the calls come to us. Anytime there's a real estate transaction that involves septic, it comes to us. It's just something else we need to do during the course of our days. With respect to facilities reopening, pools, that's been a big deal. The guidance from the state has been slow coming. Provides facilities for opening regarding social distancing. The operating of the pool hasn't changed much, but obviously the occupancy loading will. And it's going to be tricky. And I still don't know how we're going to maintain social distancing when it comes to the wading pools and the kiddie pools.
Nobody's waiting.
I just don't know how that's going to happen. But we can always tell the parents, the kids don't get sick. It's the parents that get sick, and the grandparents. So we started doing the pool permitting program in anticipation of pools opening officially tomorrow. So that's been a rush to get that done and also get these permits out, as well as that for the seasonal food service facilities. Many of the pools have snack bars that are closed. So we're trying to get out and inspect those and issue permits, review the applications. process of the fees. Inspections and guidance to personal service salons, as you may know. Hair cutters, barbers were allowed to open a couple weeks ago. As of tomorrow, the rest of the personal service facilities will be open with conditions, provisions, social distancing, PPE for staff and customers, occupancy limits, all of which fall into our purview for regulation and oversight.
David, are you prepared to, I would imagine you don't do spot checks or anything like that, but if you get a complaint, are you guys prepared to do an investigation if PPE isn't being followed or social distancing isn't, the rules aren't being followed, for somebody to go out and check?
Well, we have an arrangement with the police department actually where, you know, our legal responsibility doesn't extend to customers and, you know, occupancy loading. We don't have real legal jurisdiction there. We can tell people how far apart to put the tables and chairs, but if it gets too crowded, that becomes the police department function, not ours. So we're not doing enforcing of occupancy load. We will go in if we know that a place is adhering to the social distancing requirements, like constantly are helping the Sugar Bowl adjust the locations of his tables. You know, and he's trying to get as many customers in there as everyone as they possibly can. And you know, so we do watch that and we do get involved in that. But as far as the enforcement piece, that's a little tricky. And Don Anderson, Chief Anderson, has acknowledged that that is their.
Okay, fair enough. Thank you.
You're welcome. We've also begun our beach water sampling. That's one thing that has nothing to do with COVID. We're now posting the weekly results, acknowledging that we're taking tests weekly and making reference to that on our website. And we'll continue that through this going forward. The other bit of news is on a sidebar, is mosquito testing has been resumed by the state. So pretty soon we'll be talking about West Nile virus and hopefully not too much about Triple E. But such is the world of public health. That's a quick run through of, I think, I'm sure I left a ton of things out. It's been nonstop, you know, calls, questions, people concerned, whether it's the public, whether it's merchants. People in general want to do the right thing. And, you know, and then those merchants, in particular, the hair salons and, you know, the nail salon, personal service salons and restaurants, trying to survive. And we're trying to work with them as best we can, while protecting public health, obviously. But that's what we're doing.
David, thank you so much for the update, and thanks for keeping the board up to date, you know, throughout this. I guess the question is there anything that you need from, you know, us collectively? You know, we certainly have some extra expertise and some help, obviously, you know, between the clinical services, between, you know, Jennifer and Christina, and, you know, between Andy and Mac with his connection to the health and safety RTM piece. Is there anything that we can do to help the cause at all?
Well, short of getting me a whole bunch of money so I could hire staff that doesn't exist. You know, trained people who go out and do stuff and, you know, are willing to do this. You know, I mean, that's the reality. It's just a really, really hard time with a real lot of moving parts. And just to try to sort through the guidance and constantly changing guidance that comes through, And the detail stuff, I mean, for example, the question, one of our food service facilities wanted to have a 3-piece band play outdoors. And, researching the guidance, I find that there's reference to that. And the reference to it is that if, obviously if you're in a band, you're probably going to be singing, somebody's probably going to sing. And if you're a vocalist, or if you're going to, a person is exempt from wearing a mask. So we'll say a band member, exempt from wearing a mask if they're 12 feet away from the public and any other band member. So the level of micromanagement that is occurring throughout all of this is staggering. And it's really hard, it's really impossible. And again, Chief Anderson at today's, we had a department head meeting today. And, I wrote down what he said. And he said, it's impossible to keep up with the emails and requests for guidance and advice that comes through because it's changing all the time. And the details are just so on a micro level. Hairdressers were told they needed to wear face shields when they were first opened. And we learned immediately that because of the covering across the front of the face, any kind of vapors or anything that come up from doing hair dyes or hair treatments of any kind went up underneath the mask and people couldn't breathe. But it was a requirement that the technicians or hairdressers wear face shields. So, you have a lot of people who are making rules here who really haven't consulted with, and public health hasn't been at the table with the governor and his group in making these guidelines and bringing them forward. We've had a real struggle, and I use we from a local health perspective. It's been a big struggle to get to the table to have any meaningful input into how this reopening is occurring. And, and I would like, if there's anything that collectively you as an organized group can do, it's to try to get some local representation. And Jamie's well aware of all this. We've been in close contact all along, as far as the difficulties that we in local health and generally in communities have been having in getting clear information that isn't constantly shifting. But it has to change because people are making decisions that don't understand the businesses in essence that they're regulating and telling what to do and how to do it. This level of micromanagement is unprecedented, unbelievable, and I'm a regulator.
But I think to be fair, it seems like what we knew yesterday is different today, which is going to be different tomorrow, and having the ability to pivot some of those scientific recommendations that come out is challenging as well.
It has been, the of antibody testing, it's been a big controversy. Should we be making based on that? We require people to be tested before they go back to work. So what level of employee health monitoring is legal? And it has been a moving target. I mean, initially the guidance was don't wear masks, right? I mean, the only people who were supposed to wear masks at the beginning were those who were sick or thought they might be sick. Now everybody's wearing masks, and if you don't, well, then you're a troublemaker or something.
David, I have a question regarding schools. They just closed for the summer, but will you be involved with helping make decisions about opening in the fall?
I have two answers to that. One is I hope not, and the other is I hope. Really, certainly health is what it's all about. We should be involved, yes. And we were involved in large discussions leading up to the decision to actually close the schools. So we had a really good working relationship with Dr. Adley and with the director of nursing for the schools as those decisions were being made. We did have discussions over graduation ceremonies. We did not have any direct conversations over summer school. That was a decision made based on the evidence that they had. We certainly have been involved in the camp discussions, but as far as school come fall, everybody's waiting to see what the state's going to be recommending. And, we'll take it from there. Certainly I'm sure we'll be at the table. I expect to be.
Okay, thank you.
David, I have a question. It's Jennifer. People are getting pretty upset about these rules and regulations that nobody's adhering to. So they asked me, what are the rules and regulations? Well, I know what they have. Well, ours are tough at the hospital, but where do they find out the accurate rules for wearing masks, distancing? Like at the beach, nobody's wearing anything, nobody's distancing. Who do they call? Where do they get this information from? Do you know a good source? I mean, who should they be calling? Because they're asking a lot of questions about why nothing's being enforced. But what's the nothing? We don't know. I mean, I know what our rules are at work, but
David, you should be handing out your personal cell phone number.
Yes, right. No, I mean, I don't want to tell them to call you or the police. I say call the state, but I don't know what you recommend. What do you recommend that they do? Who do they call?
They call the Parks Department, the Police Department, but not me.
Okay. All right. Okay.
No, Jennifer, seriously. The answer to the question is CDC guidance says if you cannot maintain your 6-foot social distancing, you need to wear a mask. So what that means is if you're in an outdoor environment and, maybe you're with your significant other and you're, sitting at the beach and you're more than 6 feet away from another couple or a person, that's fine.
Mm-hmm.
Okay,
Right.
so there's a requirement that you wear a mask no matter what you do. I mean, I see people driving their cars by themselves with closed windows and they're wearing a mask. There's no reason for that.
Right. No, I know.
In fact, there's reasons not to do that. But in general, out and about, if you're by yourself or you're not within 6 feet of another person, you don't need to wear a mask. If it's at the beach, conversation has come up. If it's at a park, supposedly there are park monitors that are on duty that are supposed to be enforcing this. And if they're not,
well, apparently they're not. From what I hear from a lot of people, they are not.
Okay.
They're not even getting out of the car and doing anything. And it's been reported to Pam, but I'm just repeating now what's been told to me. I'm not telling you from myself. So people have asked me. I said, you can't go by me because the hospital is extremely tough. No visitors, no this, no that. We're really, really the other side of the pale. You know what I mean? So you can't even visit. Nobody can come with you. Nobody can, I mean, it's really tough there. So I can't go by those rules either. I mean, for the general public, but I just said, who do I refer them to where they're going to get the proper answer? And I didn't want to give any one person's name, so I said, well, geez, you can call the state of Connecticut if you want, but health department, but I didn't, I just wanted what you think. Tell me what you think to do.
Well, that's what I think is that if there's something going on at the park, then the park director needs to know because they've hired monitors that are supposed to be doing
right. That. I know they have, yeah.
So that's the answer to that question. Now, so
okay.
To the other question about what is the proper policy for wearing masks, it really is 6 feet if you can't maintain social distancing. So like if you're going to a store, you don't know if you're going to be able to maintain social distancing in a grocery store. You might be able to, but then again, you might not. So you should wear a mask. Most of those places we're saying food service facilities, you have to wear a mask to go in, customers need to wear a mask. So we're providing masks to businesses to provide to customers so that they don't have to turn anybody away. Now, there are going to be those, and there are those, and I get emails from those who are saying, this is a conspiracy, it's a scam, and nobody needs to wear masks.
Right. Yeah, they should come to work with me. They'd soon find out. Right.
Like, so, I mean, what do you do about that? So if you're a merchant in a restaurant and you're operating a restaurant, somebody comes in and they're going to be, hard-nosed about not wanting to wear a mask, it's sort of like, well, they have the right to refuse service.
Right. All right. Well, I just wanted to get a little bit of an idea of where to refer them if they have questions. I didn't want to refer them to you or to the police I just told them to call Hartford, and find out from the health department up there. And that's what I told them. But a lot of complaints about nobody enforcing anything. But I don't know what they're supposed to be enforcing. I mean, I only know where I work, so that's it.
Yeah, well, that's what they're supposed to be enforcing. That was the guidance that has been adopted by the Parks and Rec Commission. And the Parks and Rec Commission needs to know if it's not being followed. Same thing like with the dogs.
Okay. All right. Thanks a lot. That's very informative. That's helpful. Thanks.
You're welcome. Any other questions, comments, thoughts?
No, I'm good.
David, just in terms of procedure, because I was a minute or two late, did we officially approve the December minutes?
Yes.
Okay, thank you.
You're welcome.
Thank you.
Thank Mac for that.
Any other issues? Okay, looking forward, our next meeting is scheduled for Tuesday, the 8th of September at 5 p.m. Hopefully we will all be able to get together in person for that one. As always, we'll send out a reminder and it will be in the minutes to this meeting as well. Anything else, gang?
With respect to the September and going forward, I'm not sure what our town hall hours are going to be. I'll revisit that, as we get closer to September.
Sure.
Right now, we're operating on a 8 to 5:15 schedule. So let me get back to you on that date, okay, in those times. But we'll keep the date.
I just want to say thank you, David, for everything you've been doing. My goodness, you really do need a day off.
Thanks, Matt. And I don't want to give out my cell phone number. Do you have it?
I got it.
Yeah, I know. All right, folks. Well, thank you. Thanks for your support.
Okay, everybody.
David,
nice
do you
all.
Do you have time for a quick call?
Yes, I do.
I'll call you in your office, all right?
Okay, thanks.
Okay, thanks.
Okay, thanks,
Thank
everyone.
you, everybody.
Thank you so much.
Yep, bye now.
Bye.